Hello everyone, my name is Dr. Andrew Park. I'm a board certified pain management physician. Today we will be talking about facet generated pain. First, let's talk about what facet joint is. Facet joint runs from your cervical spine, your neck, all the way down to your lumbar spine, giving motion in your spine. Basically, when the two vertebrae, the bones, your spine meets, it creates a joint in the back called the facet joint. And this is a very common area that generates pain in your spine. When it comes to the treatment of the facet joint pain, from an interventional pain standpoint, there's two main treatments for it. One is a simple steroid injection into the facet joint called a facet joint steroid injection. And then another treatment is called the medial branch block, followed by the radiofrequency ablation. The radiofrequency ablation is basically a denervation procedure, meaning we are trying to remove the nerve surrounding the facet joint called the medial branch nerve. By doing that, you get the relief because you do not feel pain coming from those facet joints. When we compare the two different procedures of the facet steroid injection and radiofrequency ablation, studies show that radiofrequency ablation has better outcome and longer duration of relief compared to the facet steroid injection. So how do we determine if your pain in the back is coming from facet joint? Usually by history. If you have pain that's localized in the low back or the neck that does not radiate down your arms or legs, from that history, we think more of a facet pain. Also, on imaging, you may have some arthritis developed already, and that could be a clue, but not always the case because sometimes you can have whiplash injuries or traumas that can lead to facet joint disruption. Lastly, the gold standard to determine if your pain is coming from the facet joint or not is called a medial branch block. And that is the nerve that supplies innervation to the facet joint. And I block those nerves using just local anesthetic to see if your pain goes away that day. This is a purely diagnostic injection, meaning that there is no therapeutic benefit. You do not get long-term relief from medial branch blocks. You only get anywhere between several hours to up to about 24 hours of relief. And it is a very important procedure to determine diagnostically if your pain is coming from the facet joint. So where does medial branch block and radiofrequency ablation tie in together? Basically, it is required to do the medial branch block to confirm the diagnosis of facet joint pain in order for you to proceed with therapeutic radiofrequency ablation. However, usually from an insurance requirement standpoint, you do need two sets of medial branch blocks, meaning if the first medial branch block gave you 80% or more pain relief for the first 24 hours after the injection, then we have to do a second set of the same medial branch block, and you need to have a good same robust response to the second injection in order for us to proceed with the radiofrequency ablation. The reason for that is to dial in and determine if you have pain generated from the facet joints. There is something called a false positive where you can have a good response, sort of like a fluke response to the first injection. And we really want to eliminate that chance by doing a second medial branch block and really confirming that your pain is coming from the facets. So what do we expect from the radiofrequency ablation? Radiofrequency ablation, I insert a needle that's specialized for this procedure where the tip heats up to about 80 to 90 degrees Celsius, and we burn it for about a minute and a half to 2 minutes to denervate the medial branch nerve. What you can expect after the radiofrequency ablation is not usually an immediate relief like a medial branch block or epidural steroid injection. You may be sore for about 2 to 3 weeks. You might also have some burning sensation in the neck or the low back, and that is a very common finding after the radiofrequency ablation. However, that subsides and then the relief starts to kick in over the next 4 to 6 weeks after the procedure. So it is somewhat of a slow process getting to the therapeutic benefit. How long do these facet treatments last? Radiofrequency ablation on average lasts about 10 months to a year, and the facet joint injections usually last about 3 months to 6 months. Therefore, the radiofrequency ablation has a longer therapeutic benefit compared to the steroid injection. The facet ablation or radiofrequency ablation, in the future, the reason it comes back is the nerves grow back and start to transmit signal, which is the painful signals again to your brain. When that happens and it's the same pain, usually we can skip the medial branch block and go straight to the radiofrequency ablation for a quicker turnaround on the subsequent radiofrequency ablations for you.